About 900 GP clinics are being progressively activated as Public Health Preparedness Clinics, or PHPCs, to care for patients with respiratory symptoms. And so far, the number is around 700.
This center is one of some 900 PHPCs. I'm going to show you how operations are like compared to a regular clinic. Over here, patients' registrations start from outside the clinic. Patients need to fill up a questionnaire about their travel history. Should any patient be deemed a suspect case, he or she will be brought through the clinic's back door to enter the isolation room away from where doctors usually see their patients. In the isolation room, the doctor uses a different set of medical equipment. He will also don PPE while examining the patient to prevent any potential transmission. Suspect cases of the COVID-19 will be sent to the National Center for Infectious Diseases. It's expected that workload may increase due to the assessment required, but the doctor at this clinic tells me that they don't intend to keep patients waiting too long for assessments. They'll also be looking at the patient's overall condition rather than just cold or flu symptoms in determining if they should be isolated.
All of them presents relatively similar with flu symptoms such as cough, sore throat, runny nose, fever. That's why we need to depend a lot on the patient's history, whether this patient has traveled to China or whether there's a positive contact history. And based on that, as well as our clinical assessment, whether this patient is stable or unstable or having any chest infection like pneumonia, then we would then decide on the treatment.
During this period, PHPC clinics will also offer medical subsidies to patients with respiratory symptoms. These include acute upper respiratory tract infection, influenza, pneumonia, and acute bronchitis.
The Health Ministry has been distributing personal protective equipment to PHPCs like this one at Raffles Place. The supply runs started on Saturday for items like N95 and surgical masks, isolation gowns and non-sterile gloves. CNA understands that PHPCs are required to have at least a week's supply of such equipment in view of Dorscon Orange. A doctor tells us PPE is an extra precautionary measure to keep both patients and clinic staff safe.